We've heard from some people like it looks like we're on Hacienda's side, and we are absolutely not on Hacienda's side. We want them to provide good service.
Thursday night, Arizona's family breaking the news the state had reached an agreement with the healthcare facility to continue to operate their ICF unit with their state license after a year of severe abuse and issues. Dr. Christ faced my question head on.
You have a lot of people that look at this and say, well, a patient was raped allegedly by her own nurse. She's at a care facility and somehow nobody knew she was pregnant. Then she gives birth. Then another patient is found with maggots on his throat. And people say, how could you keep this facility open? What's your response to that?
The population that Hacienda serves is a very vulnerable population. Some of the most medically fragile patients we have in the state are at Hacienda. We know that moving them puts them at a higher risk for a bad outcome or even death. This is not going to be an easy 12 to 18 months for Hacienda. These agreements have a lot of requirements, a lot of things that need to be done. They're going to cost a lot of money to Hacienda.
That'll total at least $200,000 more a year, and the facility will have to bring in a third party to monitor and oversee inspections within a week. That third party will be there for a year and a half. If Hacienda doesn't meet these requirements, the state and the federal government could pull their Medicaid funding or issue an intent to revoke their license again.
What's your message to the families who have gone through this, the nurses, the doctors, the staff at Hacienda who have endured a long and brutal year with everything?
I would say, to take comfort in the fact that we are doing everything we can to keep these patients safe and in their home.
Dr. Chris says the silver lining through the Hacienda investigation this past year was how much more oversight the ICF facilities in the entire state needed. And now that they're all licensed, she says patient care and safety should be far better in all 10 of these ICF facilities.